You survived the hospital, but you didn't survive the bill. You walked out alive, and straight into a second diagnosis no one warns you about: the debt. Because in America, getting healthy can bankrupt you faster than getting sick. It's not a glitch. It's the design. A system built to keep you paying, apologizing, and afraid to ask questions. Medical debt isn't just a side effect of illness. It's a business model. It's a profit center. It's a system engineered to extract maximum revenue from people at their most vulnerable moments. Before we start, drop your state in the comments. Let's see how bad this has gotten across the country. How high are the bills where you live? Who's fighting to pay off $5,000, $10,000, $50,000 for care that was supposed to help them heal? Here's what this video's about. You'll see how medical billing actually works, why the prices have almost nothing to do with the actual cost of care, how hospitals and insurers profit from confusion, the psychology that keeps you paying without fighting, and the exact steps to protect yourself before you pay a single dollar. This is educational content, not legal or medical advice. Healthcare billing, debt collection, and charity care laws vary significantly by state and even by individual hospital system. Always verify your specific patient rights and local regulations before making payments or negotiating bills. When in doubt, consult with a patient advocate or healthcare billing specialist in your area. Let's start with the illusion. The one you're told when you're signing forms in a hospital room you barely remember, when you're in pain or scared or just trying to survive whatever brought you there. The illusion is that the bill reflects the actual cost of care, that what you're being charged is fair and reasonable, that hospitals and insurance companies are simply covering their costs and maybe making a modest margin to stay in business. Except they're not even close. Because in most of America, medical prices have almost nothing to do with the actual cost of providing care, and everything to do with leverage, negotiation tactics, and maximizing revenue from a fragmented, opaque system. Hospitals set what's called a charge master price for every single service, procedure, test, medication, and supply they provide. That's their master price list, a database with hundreds of thousands of billing codes, each with a dollar amount attached to it. But here's what most people don't understand. That charge master price isn't based on the cost of supplies or labor or overhead. It's not calculated by adding up what things actually cost and adding a reasonable markup. It's often a number that can be 10 times, 20 times, even 50 times what the hospital expects to actually collect from that service. It's inflated on purpose, deliberately. The logic goes like this. Insurance companies demand discounts. They negotiate rates. So hospitals set artificially high list prices so they can offer steep discounts to insurers while still collecting the amount they actually want. It's like a furniture store that marks everything up 300% just so they can have a 70% off sale and still make their target margin. But here's the problem. If you don't have insurance, or if you have insurance but it doesn't cover something, or if you went out of network without realizing it, you're not getting the negotiated, discounted rate. You're getting billed the full charge master price, the fantasy price, the inflated number that was never meant to be paid but exists so the whole negotiation game can function. So when you see a bill for $4,800 for an emergency room visit that lasted 45 minutes, where you saw a doctor for maybe 10 of those minutes and got a basic blood test and an IV, you're not crazy for thinking that makes no sense. It doesn't make sense, not from a cost perspective, but it makes perfect sense from a revenue perspective, because that's what the system is designed to do, maximize what can be extracted from every patient interaction. But let's zoom out. Here's how the trap actually starts, how most people end up with medical debt they never saw coming. You get care. You're sick, you're injured, you're in crisis. You go to the emergency room, or you get admitted, or you have a procedure. You sign a few forms because you have to, half-conscious, in pain, overwhelmed, not really in a position to read carefully or negotiate or ask detailed questions about billing. You assume your insurance will handle it. You have insurance, after all. You pay your premiums every month. You have a card in your wallet. You gave them the information when you checked in. You think, this is what insurance is for. They'll cover most of it. I might have a copay or a deductible, but it'll be manageable. Then, weeks or months later, long after you've gone home, long after you've started to recover, you get a letter in the mail or a notification on a patient portal. Balance due $2,700, or $8,000, or $36,000. A number that makes your stomach drop. A number you can't possibly pay without destroying your finances. You call the billing department. You wait on hold for 20, 30, 40 minutes. When you finally get someone, they tell you, the insurance company denied part of the claim. Or, that provider was out of network. Or, that procedure wasn't covered under your plan. Or, you haven't met your deductible yet. You feel panic rising. You think, I did everything right. I had insurance. I went to an in-network hospital. I didn't choose my doctors. They were whoever was on duty when I came in. How is this possible? How am I responsible for thousands of dollars when I have insurance and I followed all the rules I understood? And here's the truth that nobody tells you clearly. It's not your fault. It's not because you did something wrong or because you didn't understand your coverage well enough or because you weren't careful. It's by design. The system is designed this way because when hospitals bill insurance companies, they know, statistically from years of data, that a certain percentage of claims will be denied. They expect it. They build it into their financial models. They know that insurance companies will find reasons to deny or partially pay claims because that's how insurance companies control their costs and maintain their profit margins. And when that happens, when insurance denies or underpays, the unpaid portion automatically becomes your problem. Your balance. Your debt. Your financial crisis. The hospital still got paid something by insurance, usually at their negotiated rate. But the gap between what they billed and what insurance paid, that gets transferred to you as patient responsibility. And suddenly you're on the hook for thousands or tens of thousands of dollars for care you've already received, care you can't give back, care that's already in the past, but will affect your financial future for years. Watch what happens next. This is where it turns from broken to predatory. Hospitals, especially nonprofit hospitals, often say they provide charity care or financial assistance for patients who can't afford their bills. They'll tell you, we have programs for people in difficult financial situations. We want to help. And that's technically true. On paper, these programs exist. Federal law requires nonprofit hospitals, the ones that don't pay federal taxes because they're supposed to serve the community, to have financial assistance policies and to provide some level of charity care to low-income patients. But here's what studies and investigations have repeatedly found. Millions of Americans who would qualify for charity care, full forgiveness, or significant discounts based on their income, never receive that help. Not because they don't qualify, but because they're never told it exists, or they're told about it only after their account has already been sent to collections, or the application process is made so complicated and burdensome that people give up. Hospitals often don't proactively inform patients about financial assistance. They don't screen for eligibility automatically. They send the bill first, the full, terrifying bill, and many people start paying immediately out of fear or shame or a sense of obligation, not knowing they could have qualified for forgiveness. Some hospitals send accounts to collections, report debts to credit bureaus, or even file lawsuits before ever telling patients about charity care options. And once you've started paying, once you've entered into a payment plan, you may have waived your right to apply for assistance under the hospital's own policies. And here's the part that should make you angry. Investigations in multiple states have found that some nonprofit hospitals, hospitals that are exempt from federal taxes specifically because they're supposed to provide community benefits, including charity care, are actually suing their own low-income patients for medical debts that those patients could have qualified to have forgiven. They garnish wages. They place liens on homes. In some states, they've literally sent sheriffs to serve court summonses to people who were eligible for the hospital's own charity care program but were never told about it. and those hospitals still keep their tax-exempt status. They still get to avoid paying federal and often state and local taxes worth millions or billions of dollars. They still claim they're providing community benefit by offering charity care, even as they sue patients who should have received it. Because the system doesn't punish hospitals for collecting aggressively from low-income patients. It rewards them for revenue recovery and minimizing bad debt write-offs. The incentives are completely backwards if you think the goal is patient well-being. And here's the part no one talks about. Let's talk actual numbers, because this isn't about a few unlucky people or edge cases. This is the norm. This is how the system functions for tens of millions of Americans right now. Over 100 million Americans currently have some form of medical debt. That's approximately 40% of adults in this country. Not 40% of people without insurance. 40% of all adults, including people with insurance, people with jobs, people who thought they were covered and protected. And collectively, they owe over $195 billion in medical debt. Not for luxury spending, not for things they chose, for staying alive, for treating illness, for surviving emergencies, for giving birth, for getting the care they needed when their bodies or their children's bodies required it. And here's something that makes it even more insidious. About half of that debt is under $2,000 per person. These aren't all catastrophic six-figure bills from cancer treatments or multi-week ICU stays. A huge portion of medical debt is relatively small amounts. $800, $1,500, $2,300. And that's exactly the point. That's the trap. It's small enough that people feel ashamed instead of outraged. They think, it's only $200, other people have it worse. I should be able to handle this. It must be my fault that I can't. They don't fight it. They don't question it. They don't organize with others or demand change. They just quietly pay, little by little, month after month, sacrificing other things they need to chip away at a bill they might not have even owed in the first place if they'd known to apply for assistance. And that slow payment, that quiet compliance, that shame-driven acceptance, that's what the entire system depends on to function. If everyone with medical debt suddenly stopped paying and demanded itemized bills and applied for charity care and fought every charge, the system would collapse. But most people don't, because they're isolated, they're ashamed, and they don't know their options. Drop "yep" in the comments. If you've ever paid a medical bill you weren't sure was correct just because you were scared of what would happen if you didn't. Here's where the psychology becomes a weapon. Because medical debt isn't just a financial burden, it's an emotional trap designed to keep you compliant. When you owe money for a medical bill, you don't just feel broke or stressed. You feel guilty. You feel like you're paying for the privilege of being alive. You feel like you did something wrong by needing care, by getting sick, by having a body that broke down or got injured or required intervention. That guilt is the real trap, because guilt keeps you silent. It keeps you ashamed. It keeps you from asking questions or pushing back or demanding transparency or applying for help you might deserve. And hospitals and collection agencies understand this psychology extremely well. They use language specifically designed to sound authoritative, urgent, and intimidating. Final notice. Immediate payment required. Your account has been flagged for further action. Failure to respond may result in legal proceedings. That language is carefully chosen. It's designed to trigger fear and compliance, to make you feel like you're in trouble, like you're running out of time, like you need to act immediately before something worse happens. But here's what they rarely tell you clearly, what they're counting on you not knowing. Medical debt is not like credit card debt. It's treated differently under federal law and in many state laws. In most states, medical debt under certain amounts cannot result in jail time. Debtors' prisons are unconstitutional. Medical debt generally cannot be collected from Social Security benefits. And as of recent policy changes by the major credit bureaus, medical debt doesn't appear on your credit report until it's been unpaid for at least a year, and paid medical collections must be removed entirely. But debt collectors count on you not knowing any of that. They count on fear doing the work for them. They count on you thinking you're one missed payment away from losing everything, from being arrested, from having your life destroyed. That fear is profitable. Your panic leads to payment. And payment, even payment of bills you could have had reduced or forgiven, is the entire goal. Let me give you a real example. No names, but this is a true story that happened, and stories like it happen every single day across this country. A woman in Illinois went to the emergency room with severe stomach pain. She was there for about 90 minutes total. They ran some tests, gave her IV fluids, did a CT scan, and sent her home with instructions to follow up with her primary care doctor. A few weeks later, she got the bill. $12,800. $12,800 for 90 minutes. Her insurance paid about $4,000. She was left with a balance of $8,800. When she called to ask about financial assistance or charity care, because she'd read that hospitals had programs for people who couldn't afford their bills, she was told that the application deadline had passed. There's a window, apparently, after you receive care when you can apply for charity care, and she'd missed it. But here's the thing. She was never informed that deadline existed. Nobody told her when she was in the emergency room. Nobody told her when she got the first bill. She only found out about financial assistance by researching online on her own, and by then it was supposedly too late. Within 90 days, her account was sent to a debt collection agency. Within 6 months, she was being sued by the collection agency. And during that entire time, she was still recovering from the emergency surgery they'd eventually done to remove her appendix. She was unable to work full-time because of complications, and she was terrified of losing her apartment because she couldn't afford rent and medical debt payments at the same time. Her story isn't rare. It's not an outlier. It's routine. It's how the system works for millions of people every single year. Let's zoom out again to the economics of medical debt, because understanding the business model helps you see why it's so hard to escape. Medical debt is now a traded commodity. It's bought and sold like stocks or bonds. Hospitals regularly sell portfolios of unpaid patient bills to debt-buying companies for pennies on the dollar. A $1,000 debt might be sold for $40 or $50 or $80, depending on how old it is and what the collection prospects look like. The debt buyer, a company that specializes in purchasing and collecting old debts, pays the hospital that small amount, and the hospital writes off the rest as bad debt, which they can often use as a tax deduction or to justify their charity care claims for maintaining nonprofit status. Then, the debt buyer tries to collect the full $1,000 from you. They didn't provide your care. They have no relationship with you. They didn't save your life or treat your illness. They just bought a spreadsheet with your name and balance on it. But now they own that debt legally, and they will pursue you for the full amount using every legal tactic available. If they collect even half, $500 out of that $1,000 debt they bought for $50, they've made a 900% return on their investment. That's why the medical debt buying industry is so profitable. The margins are enormous if you can collect. And debt collection agencies have learned over time that medical debt is one of the most profitable forms of consumer debt to pursue. Why? Because people are more likely to pay it, even when they can't really afford it, even when it means not paying other bills, even when it destroys their financial stability. Because people see medical debt as a moral obligation. They think, these people saved my life. These doctors and nurses took care of me. I owe them. They feel like not paying would be wrong, ungrateful, dishonorable. But here's what you need to understand. You don't owe loyalty or gratitude to a billing department that inflated your charges, failed to inform you about assistance programs, and sold your debt to a third-party collection agency that had nothing to do with your care. You owe respect to yourself and your survival. You owe care to your own financial health. You owe it to yourself to fight for fair treatment in a system that is actively designed to extract maximum money from you at your most vulnerable moment. So how do you actually break out of this trap? How do you protect yourself before you've paid thousands of dollars you might not have actually owed? Here's the framework that works, the step-by-step process you need to follow before you pay anything. Step 1. Get an itemized bill. Always. Never, ever pay a lump sum balance due statement without seeing exactly what you're being charged for. Hospitals are required by law to provide an itemized statement if you request it, though they often don't send it automatically because they'd rather you just pay the summary amount without questioning it. Call the billing department. Say, I need a fully itemized bill showing every charge, every service code, every medication, every supply, and the price for each item. I need it in writing. When you get that itemized bill, and this is critical, read through it carefully. Look for duplicate charges. Look for services you don't remember receiving. Look for medications you weren't given. Look for charges that seem wildly inflated, like $15 for a single dose of Tylenol or $50 for a pair of non-sterile gloves. Medical billing errors are shockingly common. Studies have found that a significant percentage of hospital bills contain at least one error, and those errors almost always favor the hospital, not the patient. You're not looking for errors because you're paranoid. You're looking because they're statistically likely to be there. Step 2. Request a billing code review and appeal insurance denials. If your insurance company denied part of your claim or paid less than you expected, it might be because of an incorrect billing code. Medical billing uses extremely specific codes, CPT codes, ICD-10 codes, dozens of different classification systems, and if the hospital uses the wrong code, insurance can deny the claim even though the service should have been covered. Ask the hospital billing department to review the codes on your claim. Say, my insurance denied this claim. I'd like to request a coding audit to make sure the correct codes were used. Sometimes one incorrect code, like marking a procedure as elective when it was actually medically necessary, or coding something as outpatient when it should have been emergency, makes the entire difference between coverage and denial. You also have the right to appeal insurance denials directly to your insurance company. Don't just accept the denial. Call them. Ask for the specific reason the claim was denied. Ask what code or policy provision they're citing. Then ask how to file an appeal and what documentation you need to provide. Insurance companies count on most people not appealing, but many denials get overturned when someone actually challenges them. Step 3. Apply for charity care or financial assistance, even if you think you won't qualify. Every nonprofit hospital in America is required by federal law, specifically the Affordable Care Act, to have a written financial assistance policy. That policy must be publicly available. You have the right to get a copy of it and to apply for assistance based on the criteria they've established. Call the hospital billing department. Say, I'd like to apply for financial assistance under your charity care policy. Can you send me the policy and the application? Don't ask if you qualify. Don't let them screen you over the phone. Just request the policy and the application in writing. Many hospitals have policies that provide free or discounted care to patients earning up to 200, 300, or even 400% of the federal poverty level. Depending on your household size and income, you might qualify even if you have a job and insurance. Fill out the application completely. Provide all the documentation they ask for: pay stubs, tax returns, bank statements, whatever they require. Submit it even if you're not sure you qualify, because the worst they can say is no. And if they approve even a partial discount, that's money you don't have to pay. And here's the key. Apply before you start making payments, if at all possible. Some hospitals have policies that say if you've already started paying or entered into a payment plan, you can't apply for charity care anymore. Don't let fear or pressure rush you into paying before you've explored all your options. Step 4. Negotiate before the debt goes to collections. If you've requested an itemized bill, appealed insurance denials, and applied for charity care, and you still have a balance you genuinely owe but can't afford, negotiate directly with the hospital before they send your account to collections. Once a bill goes to a collection agency, the hospital has already written it off and possibly sold it. At that point, paying the hospital directly doesn't benefit them anymore, so they have no incentive to negotiate with you. But if you negotiate while the hospital still owns the debt, they have a strong incentive to settle. They'd rather get some payment from you now than nothing, or than whatever small amount a debt buyer would pay for your account. Call the billing department. Say, I want to pay this bill, but I can't afford the full amount. If I can pay Xlars in one lump sum right now, will you accept that as payment in full and close the account? Start with an offer of 30 to 40% of the total if you can come up with that much. Be polite, but firm. Don't explain your whole financial situation or apologize. Just make a clear offer. They might say no initially. They might counter with a higher number. That's fine. This is a negotiation. Many hospitals would rather accept 50 or 60% of a bill immediately than chase you for 100% over months or years. Get any agreement in writing before you pay anything. Make sure the letter says clearly that your payment will be payment in full and that they'll close the account and not report it to credit bureaus or send it to collections. Step 5. Know your legal rights under federal law. There are specific laws that protect you from the worst practices in medical billing and debt collection, but they only help you if you actually know about them and invoke them. Under the No Surprises Act, which went into effect in 2022, you cannot be billed out-of-network rates for most emergency services at an in-network hospital, and you can't be billed out-of-network rates for non-emergency services at an in-network facility if you didn't give written consent to see an out-of-network provider. If you get a surprise bill that violates this, you can dispute it through a federal process. Under the Fair Debt Collection Practices Act, debt collectors, including agencies collecting medical debt, cannot threaten you, harass you, lie to you, or use deceptive practices. They can't call you at work if you tell them not to. They can't contact you before 8 a.m. or after 9 p.m. They can't threaten legal action they don't intend to take or aren't legally able to take. If a collector violates these rules, you can report them to the Consumer Financial Protection Bureau and potentially sue them. And under new credit reporting rules that went into effect recently, paid medical collections must be removed from your credit reports entirely. Medical debt under $500 is excluded from credit reports completely. And unpaid medical debt doesn't appear on your report until it's been at least 1 year past due, giving you time to dispute, negotiate, or apply for assistance before your credit is affected. These rights exist. Use them. Don't let collectors intimidate you into paying immediately without exploring your options. Pause for 30 seconds. In the comments, write your state and the highest medical bill you've ever gotten, or write the most ridiculous single charge you've ever seen on an itemized bill, like $47 for 2 Tylenol or $150 for a Band-Aid. Let's make the hidden visible. Let's build a record of how broken this system really is. Here's what I want you to remember when you're staring at a medical bill you can't afford, when you're getting calls from collection agencies, when you're feeling like you failed or you're drowning. You didn't fail. The system did. Medical debt doesn't mean you were careless or irresponsible or that you made bad decisions. It means you got sick in a country where sickness has a price tag, where staying alive can cost more than most people earn in a year, where the act of receiving care can destroy your financial stability through no fault of your own. The system is designed to keep you paying forever, not because you genuinely owe what they're charging, but because you don't know how to question it, fight it, negotiate it, or stop it. Now you do. You know to request itemized bills. You know to apply for charity care. You know to negotiate before paying. You know to appeal insurance denials. You know your legal rights. You know that collectors are counting on your fear and shame to keep you compliant. And you know that you're not alone. Over 100 million Americans are in this with you. This isn't personal failure. This is systemic failure. This is a business model that profits from human suffering and vulnerability. So comment your state below or tell your story. How high was your biggest medical bill? What were you charged for that made absolutely no sense when you saw it itemized? Did you know about charity care before you started paying? Have you successfully negotiated a bill down or gotten charges removed? Your story might be exactly what someone else needs to hear right now. Someone scrolling through these comments terrified about their own bill. Someone who thinks they're the only one who can't afford their medical debt. Someone who's about to pay thousands of dollars they might not actually owe. Make the hidden visible. Share what happened to you. Because the more we talk about this publicly, the less shame has power. And the less shame has power, the more people will fight back instead of quietly paying. If this video opened your eyes, if it made you angry or gave you clarity or made you realize you have options you didn't know about, hit subscribe. And share this with one person you know who's dealing with medical debt or who might face it in the future. Because in America, that's almost everyone. Knowledge is power. And this system only survives where confusion and shame live. You survived the hospital. You survived whatever brought you there. Now it's time to survive the bill without letting it destroy everything you've built. You're not alone. You're not powerless. And you're not required to suffer in silence while a broken system profits from your pain.